Nurse practitioner Jen, how can I help you? Hey, Miss Smith, how are you feeling? Not good? Uh-oh. What's going on with you? Yeah, you're having some headaches, okay, and some nausea. Any vomiting at all? No vomiting, that's good, okay. How about pain anywhere? You're having some stomach pain, okay. Are you having any vaginal bleeding at all? No bright red blood. Okay, that's good. That's good. Have you felt the baby move at all recently? Oh, you have. You have. Well, that's a good sign. That's a good sign. Okay, perfect. And what about any vision loss or double vision, maybe some blocks in your vision? No vision changes at all? Okay. Have you checked your blood pressure this evening? Your blood pressure's high. Yep, that's pretty high. Okay, okay. Well, it sounds like you've got some preeclampsia going on. And preeclampsia is really the high blood pressure, the vision issues, some swelling in your hands and feet, and protein in your urine would also tell us, that you have preeclampsia going on. So I think I wanna send you to the emergency room just to get checked out this evening, okay? Yeah. Don't be concerned yet. You just got some signs and symptoms that, sound like we might need to get you checked out, okay? Now, just remember, pre-eclampsia, we're really trying to prevent eclampsia. And eclampsia is seizure-like activity or unconsciousness with pregnancy or right after you give birth, okay? Now, some risk factors that you have, you're 36, so anybody over 35 are at risk for pre-eclampsia and eclampsia. This is your first pregnancy. You only have one baby, so that's, you don't have twins or more, so that's good, but that would be another risk factor. You're just a little overweight. Obese mothers typically have some eclampsia or pre-eclampsia issues. And I haven't noted in your chart that we have some family history of preeclampsia. Your sister and your mom had some high blood pressure during pregnancy. Okay. And you are African American. That's also another risk factor. Diabetes, high blood pressure, and kidney disease before pregnancy can also be a really big risk factor. And I know we talked about you might have had some pre-diabetes that you said, yeah. Teen pregnancy is also a risk factor. Autoimmune disorders can be risk factors. And then also if the pregnancy was developed by vitro fertilization, that could also be a risk factor for eclampsia, okay? But remember, the eclampsia is a seizure-like activity or the unconsciousness that we want to prevent, okay? So we're going to get you to the emergency room and just get them to check you out, okay? All right, now treatment. Yeah, I know. What's the treatment for it? Well, if you were to have seizures, they can give you some anticonvulsants to stop that. And they also could give you some hypertension medication to be able to lower that blood pressure, okay? But the ultimate treatment, if you were to have that seizure-like activity or go unconscious, would be to give birth to stop that, okay? So we may have to give birth, okay? Just, if we progress to that point, but we're not there yet, so let's not be concerned yet, okay? Good. And we're at 28 weeks now. Okay, good. All right, now things that I want you to remember, okay? So you did real good about, getting medical care throughout this entire pregnancy because you knew you were a little at risk. So that's great. So we kind of are able to catch it a little early. We've been watching and monitoring for this. And also, emergency symptoms that we want to get emergency help right away is if we were to have a seizure or if we had a decrease in consciousness or alertness. If you were kind of in and out of it throughout the day, we might want to get you checked out, okay? And remember, we're seeking medical attention because you have some of these symptoms, but medical attention, the signs and symptoms you need to seek medical attention for would be that nausea and vomiting, if you had some vision loss, that pain in your abdomen, the severe headache, and if you weren't feeling the baby, we need to get that checked out as well. And then also some bright vaginal bleeding. We want to get you checked out, okay? But you're doing good. You called me and we're going to get you in, okay? We're going to get you some help and make sure that the baby's okay, all right? Good. I'm glad that you called, and I'm glad that we're able, to get ahead of this before it progressed to eclampsia, okay? The cause is really unknown for eclampsia. and preeclampsia. Some things that play a role in it would be, vascular insufficiencies, some neurological factors, your diet and genetic factors all really play a role in, the eclampsia and pregnancy in general. So those all could have a cost to it, but the cause just isn't directly known. Yeah. All right. Well, we're going to get you to the ER and we're going to get some labs drawn on you and check that blood pressure. Okay. All righty. Good to talk to you too. All righty. Bye-bye.